And across the nation, cases continue to rise. Studies have revealed that state leaders' different approaches to handling the pandemic have rendered very different results. Melanie Christopher is with us now and explains how Mississippi has been identified among others. Melanie?
Jade, an unpublished document prepared for the White House Coronavirus Task Force recommends that 18 states in the coronavirus red zone for cases should roll back opening measures and surging cases. Now, the red zone is determined or defined as those core-based statistical areas and counties that during the last week reported both new cases above 100 per 100,000 population and a diagnostic test positivity result above 10%. Now, Mississippi and its neighboring states of Louisiana and Alabama fall under both types of red zone categories. Not listed on either red zone list is the state of Connecticut. Now, while we may not be geographically close to Connecticut, that state is much like the Mississippi population. Alexandra Field compares the two states and reveals why the outcomes of the pandemic in each state differ.
If every state is now a COVID case study, Connecticut counts as an early model for success, getting control of a surge back in April.
Positivity rate continues to be under 1% and one more fatality, damn it. But we are making progress.
Mississippi is a different story, dealing with the surge that has been devastating the South since June.
We continue to be in a dangerous position. I'm telling you, it's real. It's deadly. And it is getting worse, not better.
The two states have similar sized populations, but their daily COVID case numbers have been near opposites. Toward the end of May, Connecticut and Mississippi had nearly the same number of new daily cases. That's when they made critically different decisions. In Connecticut,
I think we can proceed on a very thoughtful basis with those businesses that are least likely to be dangerous.
In Mississippi,
all businesses will be open. Freedom with risk is better than a prolonged shutdown.
Fast forward to July.
We're seeing a growth here because I think in large part a refusal to listen to the science, a refusal to follow the advice of healthcare professionals.
Hospitals in Mississippi are stressed, according to state officials. This week, Mississippi reported its highest number of COVID hospitalizations since its first case was confirmed in March. At least 30 state lawmakers have tested positive in an outbreak at the Capitol. Masks are now mandatory in 13 of the state's 82 counties. The governor is encouraging their use statewide. In Connecticut, where they battled the early surge,
the numbers were climbing, doubling every 3 days.
Masks have been mandatory statewide for months.
I'm a little concerned that people took our example of how we were able to pull out of it and didn't get the right message. They got the message that, oh, maybe this wasn't that bad.
Now, please note that the Mississippi-specific statistics in that piece were updated a few moments ago. As explained earlier, Connecticut is remaining vigilant with required quarantines for travelers from 42 states, and Mississippi is indeed on that list. To read more about the coronavirus red zones, visit our website, WJTV.com.